live for your coronavirus update for the March the 31st, 2020. The numbers came out at 11:28 and 18 seconds, and the numbers are continuing to get worse. Currently, we have 3,817 confirmed cases of COVID-19 with 800 and 818 cases where they have been hospitalized and 108 deaths. And I've been getting calls, people. I've been getting a lot of calls from a lot of different sources, a lot of individuals who work in the healthcare field, a lot of elected officials and family members and friends who are being affected by either knowing somebody or they themselves have tested positive. And this is getting extremely real. And what I would just want to say before I break down the numbers is that we have to pull together as a state. We have to pull together as a local community and get real about what's happening right now. Every single day, we watch press conferences from the highest office, and we're continuing to be gaslit. And we have to take ownership in this moment and pull together and lead from the bottom. We have to lead from the bottom on the local and state level as our governor continues to refuse to order a shelter in place. Many essential workers, healthcare workers, law enforcement are getting sick from the coronavirus, and we have a failure of leadership at the top. But we'll talk about that another day. Let's focus on what's happening right now. And again, in Georgia, we have 3,817 cases. We have 818 hospitalizations and 108 deaths. Fulton County, 547 cases, 17 deaths. Dougherty County, 455 cases and 18 deaths. DeKalb County, 325 cases and 3 deaths. Cobb County, 272 cases and 11 deaths. Gwinnett County, 333 cases and 2 deaths. Bartow County, 129 cases and 2 deaths. Carroll County, 122 cases and 1 death. Clayton County, 96 cases and 3 deaths. Lee County, 85 cases and 6 deaths. Henry County, 76 cases and 2 deaths. Cherokee County, 74 cases and 2 deaths. Hall County, 65 cases, no deaths. Clark County, 50 cases, 5 deaths. Douglas County, 48 cases, 1 death. Fayette County, 44 cases, 4 deaths. Forsyth County, 43 cases, 1 death. Coweta County, 40 cases, 2 deaths. Richmond County, 40 cases, no deaths. Terrell County, 39 cases, 2 deaths. Rockdale, 34 cases, 2 deaths. Floyd County, 33 cases, 2 deaths. Sumter County, 32 cases, 2 deaths. Mitchell County, 31 cases, 1 death. Newton County, 29 cases, 0 deaths. Worth County, 29 cases and 1 death. Paulding County, 28 cases, no deaths. Houston County now has 27 cases and 2 deaths. Early County, 26 cases and 1 death. Chatham County, 25 cases and 2 deaths. Columbia County, 23 cases and 0 deaths. Lowndes County, 21 cases, 1 death. Bibb County, 20 cases, no deaths. Muskogee, 19 cases, no deaths. Tift County, 19 cases, no death. Barrow County, 18 cases, 2 deaths. Glenn County, 17 cases, 0 deaths. Gordon County, 16 cases, 1 death. Polk County, 15 cases, no deaths. Troup County, 15 cases, 1 death. Colquitt County, 14 cases, no deaths. Crisp County, 14 cases, no death. Oconee County, 14 cases, no death. Lawrence County, 13 cases, no death. Spalding County, 13 cases, no death. Coffee County, 11 cases and no deaths. Dawson County, 10 cases and no deaths. Whitfield County, 10 cases and 1 death. And then we'll go to the cases that are under 10 but have a death. Peach County, 7 cases, 1 death. Pickens County, 6 cases, 1 death. Baker County, 4 cases, 1 death. Baldwin County, 4 cases, 1 death. Madison County, 3 cases, 1 death. Grady County, 1 case. Heard County, 1 case, 1 death. And we have 159 unaccounted for cases and 1 death. And currently, testing wise, we have 14,260 cases from the commercial lab, 1,821 from the Georgia Public Health Laboratory, for a grand total of 2,000, about 16,000 tests. So 16,000 tests, and you can clearly see that this is around the state. As you notice, almost half the counties have 10 cases. Almost half the counties. And we now have the map of Georgia almost exceedingly full. We have 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20 counties. 20 counties out of 159 that don't have any cases. So that's 139 counties that currently have coronavirus cases. And so, again, I don't know how to put it better than the governor of this state needs to order a shelter in place while we still can. Experts at Emory are saying that this virus will hit its peak in Georgia between April the 27th and April the 24th, with as high as 84 deaths in one day. Again, this virus is spreading. The top counties, again, Fulton, Dougherty, DeKalb, Cobb, Gwinnett, Bartow, Carroll, Lee, Hall, Clark. This is more than just a metro area. This is more than just an urban issue. It's hitting the urban counties harder because we have more population density, but it's spreading. And we have to get real about the lack of effective testing. Because if 16,000 tests gives you almost 4,000 cases and almost 1,000 people hospitalized, we're running at almost a 3% mortality rate, a 21% hospitalization rate, and a 30% infection rate in this state. And we're having a failure of leadership at the highest level. So now I've been getting phone calls, and I kind of posted this earlier on Facebook that I was getting phone calls, and the phone calls are from medical professionals who are telling me, and I'm telling them, please go public with this information, because again, I'm just an attorney. I'm trained to be able to break data down, but not medical data the way they can break it down. But they're saying the same thing. We don't have enough personal protective equipment. We don't have enough ventilators. We don't have enough beds. And we already in a state that failed to give Medicaid expansion. So what does that mean for the rural counties, some of which don't have hospitals? We are going to reach the point where the hospitals are overrun. I have friends who said their loved one went to the hospital complaining of another ailment, came back, and they were positive. We have to deal with this issue. We need adequate reporting from our media outlets, and we need an adequate response from our elected officials. Tell the people the truth so the people can help fight this pandemic. We need social distancing. If you see people that are not abiding by the 6-foot radius, you need to call them out and say, listen, this is not just about your health. This is about everyone's health, because there are families that have been affected. Chris Cuomo, the anchor from CNN, and I know a lot of y'all don't watch CNN, but he's affected. He's infected. And we still are not getting the message across effectively. And this is a message, and I know I have a multicultural following, but this is a message directly to Black people. Okay, I'm talking to the healthcare providers, and they're saying that our already pre-existing conditions are making this run rampant in our community. They're not releasing the statistical data based on race, and I don't want to make this a thing about race, but we already know. We already know. And my fear is that as the urban areas become overrun and the rural areas become overrun, we start dealing with individuals who have a lessened immune system, who have compromised pre-existing health conditions, and this virus does not help with those conditions. So we got to get real. And I need everybody that is on my live to please do me a favor.